Hi, everyone. Today we have another co-author spotlight of the book, How Healers Heal. We have Dr. Wendy Stammers, all the way from the UK. Hi, Dr. Stammers.
Hi, Shilpi.
I'm so excited you're here with us today. Can you give us a little introduction to who you are and what you do?
Absolutely. So my name is Dr. Wendy Stammers. I'm a GP, a board certified lifestyle medicine doctor, and a health and wellness coach based here in the UK. And I'm also the co-founder of Hero of Health, which is a healthy neighborhood network. And through our digital solution, our passion and purpose is to cultivate a world where everyone has a neighbor with whom they can share healthy lifestyle habits.
That is so wonderful. I love your story in our book, How Healers Heal. Without giving it away, can you share with us a little bit about how you got introduced into lifestyle medicine? And of course, it's become your life with Hero of Health, and a little bit about your practice now.
Absolutely. Where do I start? I suppose actually lifestyle medicine, unbeknownst to me, has been with me since childhood. I was privileged enough to live a really healthy, active life. We were always outside playing with other kids in the village, always being active, known as the child that never sat still. And never, I can't really remember sat watching the TV or anything like that. So I had that active upbringing, along with, again, a privileged situation where my mum only cooked from scratch. We had unprocessed foods. The fridge was full of fresh, healthy veg and fruits and things for me to snack on whenever I was hungry. Developed a really lovely, healthy gut microbiome is how I would say now. And this has stayed with me throughout my life and is still really strong in my life now. And it facilitated me pursuing sport and becoming an athlete, and then also through my medical training. And as a GP, I always wanted to sort of promote lifestyle and really encourage people to have faith that lifestyle actually really does impact our health and can be, the decider between ill health and wellness. And what I found, the more years that passed as a GP, and the more I was kind of reading, that I wanted to really help more and more people with lifestyle measures, but felt frustrated by the system because I couldn't do this within each of my 10-minute consultations. And therefore, I felt like I was doing my patients a disservice, because actually, as we know with the statistics, our patients are getting sicker and sicker and sicker, and we've got a pandemic of chronic diseases despite the advances in medicine. So with that, I came across, I vividly remember actually 2018, listening to a story, listening to Dr. Rangan Chatterjee being interviewed on the radio, with the release of his first book, The 4-Pillar Plan. And I thought, oh my goodness, this doctor is talking to me. This is exactly what I've been trying to find as the tool with which I can treat my patients. And that really sort of increased my curiosity and hunger for it. I read his book, I listened to podcasts, and my knowledge just went, I suppose, just skyrocketed. I then went to the British Society of Lifestyle Medicine conference to kind of see whether I fitted into this kind of tribe as such, and I was just so amazed at the positivity and the solutions that people were coming up with, and the evidence, the massive amount of evidence that supported lifestyle medicine that in our conventional training we don't know about, we don't hear about, I didn't read about. So suddenly I had the evidence to back it, that actually what I was feeling my patients needed is actually a thing, and it's proven. So with that, I remained in general practice. I continued to try and deliver this on a patient by patient basis, and then realized that I could not carry on like this, and made the really difficult decision actually to step away from a partnership that I'd been in with for 10 years in order to pursue this burning light that was inside me. And then I came across Dr. Linda Mizzen here in Sheffield, who was a few years ahead of me with her board certification in lifestyle medicine. She's an A&E doctor, and we co-founded Hero of Health. And through this journey, it has been incredible. And we, for the last year, have been walking with patients from a GP practice, and we've got into the community. We are bringing lifestyle medicine to the community, and the impact it is having is incredible. And through this, we have identified that patients actually are really hungry for the information that we have to share, and are astounded by the fact that their chronic conditions can actually be reversed. And the number of times I hear, Wendy, are you really saying that my diabetes can be reversed? I've never heard this before. When I was labeled, I felt disempowered, I felt sad, I felt guilt, I felt shame. And I thought that this was just, going to get worse and worse. And I worried about losing my eyes and my feet and my kidneys. But you're saying I can reverse this. And I just said, yes. And they're like, well, how? Well, how? And through just really supporting them and giving them hope and giving them the you can attitude, and then the tools with which they can use in order to reverse their conditions, has really instilled confidence within the group, because they're also they're seeing the results. And I think the thing that I would really like to focus on is the fact that what we are seeing is the strength of the community, and the strength of peer-to-peer support, and patients coming out of a feeling of hopelessness, a lack of purpose, and loneliness actually, that has prevented them from being able to consider their health as important and worth fighting for. And so with all of this, we have we've got, I can tell you a story. One of our patients came to us not working, with mental health difficulties. She'd been under secondary care with her diabetes for 15 years, and her HbA1c, which is the marker of the amount of sugar in your blood, was off the scale, despite being on maximum amounts of treatment, including injectable insulin. And she came to us, she walked with us every week, and within 14 weeks her HbA1c had come from 147 down to 83, which was the first time it had been under 100 for 10 years, despite all the specialist input. And her words to me were, Wendy, I'm the happiest I have ever been. I've found purpose within my community, and I no longer feel judged. I'm losing weight without even dieting. And this is all through connecting with the group, and them being able to put all the education that we are sharing in terms of lifestyle medicine into practice, because she found her purpose.
Oh my gosh, you said so many wonderful pearls. I'm going to try to highlight them. I was busy taking notes, and I have so many follow-up questions for you. So one, you said the pandemic of chronic disease. That's definitely true. And I don't think I've quite heard it phrased that way. And so thank you for that. And then the burning light and passion inside of you that you're instilling inside of each patient, and then each patient is creating this ripple effect peer to peer throughout their entire community. That's amazing. And then the quote that I loved was, you said, their health is worth fighting for, which is amazing. That's so true. And I want patients, your family, and the whole world to know that their health is worth fighting for. I loved how you phrased that. Thank you for that. Let me see here. I wanted to ask you questions about your life as an athlete and how that contributed to how that's contributing. And then how does this walking with you as a GP for Hero Health work? Like, and it's been so wonderful. So let you answer those, and then I'll come back to my next point.
Sure. So yeah, so my life as an athlete, I suppose I did sport from such a young age that facilitated me into pursuing a journey into triathlon. I entered it very late. I dabbled with it at university and actually realized that I was doing quite well, and decided to go off to Australia and train with some really world-renowned athletes, actually, and absolutely loved it. And whilst doing it, obviously that was after my medical training. Whilst I was an athlete, I was also appreciating just how important movement and exercise is for society, and how in the world of triathlon it is, all shapes and sizes do it. It was bringing a community, people were positive, and actually I could see it as a community engagement for people to be able to use it for health benefits. And again, through knowing that eating healthy and sleeping well and doing the intense training, but along with also the recovery and the rest, I could see a real connection and likeness with lifestyle medicine, basically, with those pillars of lifestyle medicine. And I pursued it, and I always said to myself, I'll carry on until I reach a plateau. But that point happened where I had to decide whether to actually focus on it and become professional and that be my job. And at that point, I felt like I'd gained enough from it. And actually, I wanted to bring my knowledge and bring my passion into medicine. And I suppose through maturity, I'd identified that the thing that gives me the biggest purpose is helping others to help themselves. So my desire as an individual athlete started to wane, and my desire to help others to help themselves increased.
So connected to that, how do you do the walk with the GP weekly? How does that work with your program?
So basically, Dr. Mizzen and I set this up a year ago, and we do it. We've been doing it in our free time without being paid, because we identified the need for it, and we were also aligned with a practice that very much supported lifestyle medicine, and we were trying to find a way to get this into the community, alongside trying to get funding from the NHS. But it was also, it's to try and work out the formula and then position it to the NHS in order for them to try and fund, this within the communities. And with the results that were becoming, very transparent, we have primary care networks over here, which is basically groups of practices that come together in sort of geographical means, really, under one primary care network. They tend to be around 5 or 6 practices, and within that we gained funding from them in order to deliver these walks. And also we've started cooking with patients in order to really bring down the barriers for why people struggle to implement the things, the changes that we're suggesting. And that came about from one of the patients actually, who said, I love all this stuff. I really love the fact that we can do something ourselves. We can look at our diet, but I really don't know how to cook, and I don't know how to put this in place. I don't know how to change my kitchen. I only have the tools that I've been brought up with, and I've got into bad habits. I just get a takeaway or whatever. And so from that, it was the patient that I just shared with you actually, who turns out to be an amazing cook. And she is now leading our cooking courses. So this is the wonderful evolution of this community project, that what we ideally want is to be out of a job ultimately, because we want to be able to facilitate the communities to look after themselves. And so our patient has she comes up with the recipes, she is able to deliver her skills and share her skills with our patients in such a humble, gentle, non-blaming, non-shaming way that people resonate with it, and they are going away with skills, life skills, and recipes and simple changes and switches that are setting themselves up for good health. So that's where it's come from, based on the kind of, on a post-it note idea that actually, why don't we go in and start walking with our patients and walk side by side with them? Because the other massively important part, or the biggest part of that, is patients suddenly feel on a level. I think within our consultations, it can so easily, because of the way it's set up, feel like you've got a doctor-patient relationship, which can become a bit parent-child-like, as opposed to actually walking side by side and listening to people's stories, and they feel heard, they feel understood, and that then opens them up to hearing and learning, because suddenly you feel really connected.
That's amazing. I love your shares and your stories and your successes, and I love how you phrased it, like we want to be out of a job, which is what all of us want. We all want the population, our communities, to be healthier and free from disease. Okay, I'm going to shift gears a little bit to our book. Oh, there you are.
Sorry, it just froze there.
I'm going to shift gears a little bit to our book, How Healers Heal. Thank you so much for being a part of the book. I love how it's an international phenomenon with you, Dr. Nakra and Dr. Shankar from India. Even my study buddies for the board exam were somewhere from other countries. I love how lifestyle medicine is global and trying to reverse a disease. But talking about the book, which I love your chapter, thank you so much for being a part of it. Why do you think doctors and non-doctors should read this book?
Yeah, well, thank you for giving me the opportunity to be part of this, Shilpi. It's been incredible, and actually having the opportunity to write my chapter really brought it to light to me as to just how important this is to get these messages out. And reading the other co-authors' chapters, I think, is just just shows how important it is for everybody to read this book, be it a doctor, be it a patient, be it a mum, be it somebody going through a chronic disease, because what it demonstrates is that through our stories, we are firstly all human as well, and that we can also go through these conditions. And secondly, just how important lifestyle is in relation to the development of chronic diseases, but also in the prevention and reversal of chronic diseases. With each story, I think throughout the book, there's such a variety with all the tips and the science also there in relation to the pillars of lifestyle medicine, I think everybody had something to resonate with, and to be able to demonstrate the impact actually is so empowering for people, and for them to go away and think, actually, I can be back in control of my health. I don't have to be controlled by an illness, by the medical profession. I can be put back in the driving seat here. And listening to those stories really does bring positivity and belief and hope for everybody.
I agree. Thank you for that. What is your number one takeaway for lifestyle changes for your patients or for self-care for yourself?
So I think this comes back again to really what sits behind the root causes of chronic disease. And for me, the big part is finding people's why. Why is health important to them? Why should they feel that they need to make changes? What is it that brings them purpose? And also looking at loneliness. We know that here in the UK, we know that 1 in 4 people have no friends. 1 in 5 people have not got a role in their communities. And the fact that loneliness, mental health, and chronic diseases are actually, loneliness, mental health, and poor lifestyle choices are the things that drive chronic diseases and premature aging. And unless we lifestyle measures into place, if you only and you were feeling ill and you've been told that you've got a chronic disease, would me coming along and saying, well, actually, if you sleep better, if you adopt, more of a plant-based diet and real whole food diet, and if you move more, that will all go away. Do you feel you could go away and do that?
Sorry, I lost you for a little bit. You were frozen, but
Sorry.
what I got was that because of loneliness, it's hard to implement lifestyle changes. And
yes, yeah.
And you're asking if could I feel like I could implement changes if I was in that state? No, I don't think so. That is definitely key.
Absolutely.
I've created friends just through this book project, and I need you all. I need my family. I need my support system for sure. Go ahead.
And that's exactly what we're seeing at Hero of Health. The patient that I described earlier, no matter how much of the service she was utilizing, the specialist nurses, the specialist consultants, all the specialist treatment, nothing was improving her health until she found purpose and connection within the community. That was the trigger for her. And suddenly she felt that she had her support network. She had an environment where she could be herself and not be blamed and shamed and blame herself for her chronic illness. Actually, she found purpose. She wanted to learn. She's putting the things in place, and her HbA1c is continuing to drop. Her insulin levels are continuing to, her insulin load is continuing to drop. And this is just one story. We've got a realm of stories that I think has really highlighted to us as we've evolved that unless we get to that purpose and that reason for making change and that supportive network, we can offer all of this stuff, all of the amazing, lifestyle medicine pillars and education. But without that, it's so difficult for people to make changes.
And I was just thinking that that influences the family environment too. If you do have a family support system, but they're not supportive of your choices in trying to reverse disease with lifestyle changes, then it makes it even harder to implement. I don't think I've heard that as a number one takeaway in all my interviews yet. So thank you for that. I know our US Surgeon General did highlight the epidemic of loneliness last year, and he wrote a book called Together, which I think I highlight in the introduction, and a couple other authors. Do you highlight it in your chapter? I don't remember. A couple other authors do highlight loneliness, but wow. I'm glad you're bringing that to the forefront again for us. Go ahead.
Thank you. And I think another reason why this has become so apparent is the effects of COVID-19, and actually the effects on people's health, physical health, mental health, really demonstrated what loneliness and isolation does, the impact of that. And actually, when I'm still practicing as a GP, and when I see patients that are coming in who they're juggling life and everything is against the clock, and they have no time for connection with neighbors, with connection with friends, with connection with family, even because of this busy, productive, very efficient society that we're living in, which ultimately impacts on our health. And with the rise in autoimmune diseases, and particularly these affecting women, the majority, 80% of autoimmune diseases affect women. And I think that is all symptomatic of women juggling home life, work life, family life. And actually it's trying to identify ways in which we can support each other in our communities, and also, being able to, that's where we talk about Hero of Health, trying to make sure that everybody has a neighbor to share lifestyle habits with. And just like you alluded to, having that person or people to share a habit with makes that habit much more likely to continue and become normal, and how important it is in your family unit, your friendship units, your neighborhood, to align with people that you are wanting to create that healthy habit with.
Wow. I am so grateful that you are doing the work you're doing in your community and spreading it throughout the UK, and sharing with us here as well. It's just so inspiring. I could talk to you for hours on end some more, but I thank you for your time today. I wanted to ask if you had anything else you wanted to mention, and how to connect with you, how to reach out to you. Do you work internationally? Thank you so much.
Sure. Yeah, I suppose I would just finish with the fact that, as I said in my chapter, that I genuinely think that lifestyle medicine, and adopting these lifestyle habits is so empowering and uplifting, and a real ideal opportunity to get back into that driver's seat of our own health. And I share other stories in my chapter that can impact on people who are going through a cancer journey, people who are suffering with mental health, and the impact of lifestyle in all of these facets. We are at Hero of Health, we've got a digital solution that is bringing communities together, and that is therefore globally scalable. We are wanting, to offer this internationally. As I said, we're evolving as we're speaking, and we're getting more and more interest. We've got secondary care clinicians asking us if patients can join a walk, because we can be there for somebody right there and then in their time of need. And I think this is the other thing that's become really apparent in that when somebody is struggling or suffering and they've decided that actually now is the time that they want to make a change, patients can often be referred to a service that has a big long waiting list and, you know, months down the line, whereas actually we can meet those patients right at their time of need and give them the peer support that actually is the thing that makes the biggest difference. So yeah, I feel really excited by, you know, what we are going to become and what we can offer to as many people as we possibly can.
Thank you so much, Dr. Wendy. This has been amazing. You are so inspiring. Everyone, check out Dr. Wendy Stammers' chapter in her book. Of course, her wonderful practice at Hero of Health. And thank you so much.
Thank you, Shilpi.